I welcome you all to today's webinar on the topic Future Ready Medicine, the Robotic Revolution where Gynae meets tech. And it's a pleasure to introduce our distinguished speaker for today's webinar, Dr. Aishwarya Karthik Nagesh, an esteemed professional in the field of obstetrics and gynecology. Dr. Aishwarya holds an MBBS and an MS in obstetrics and gynecology and has completed an MRCOG1 from the UK. She is currently a fellow in minimally invasive gynecology at the Department of Obstetrics and Gynecology at Manipal Hospital, Bangalore. In addition, she is a consultant at Mother and Child Clinic in Indranagar, again Bangalore, and serves as an executive committee member for the Society for Maternal Fetal Medicine, India, under the International Society for the Study of Hypertension in Pregnancy. Dr. Aishwarya's academic contributions are noteworthy, with several articles published in both international and national journals and newsletters. Her passion and dedication to her field have earned her numerous recognitions, including the Dr. Reddy's Laboratory Prize for Best Outgoing Postgraduate in 2022, multiple medals from RJUHS, and prestigious awards for her presentations at national and international conferences. Dr. Aishwarya's area of interest include high-risk pregnancies, hypertensive disorders in pregnancies, menstrual health and hygiene awareness, and minimally invasive surgery techniques, including robotic surgery and laparoscopy. We're truly honored to have you with us, Dr. Aishwarya, in spite of your busy schedule, and we're grateful that you've joined this session. So, scholars, please, I want to let you all know that's a very interactive sessions, and you can keep posting your questions in the Q&A box, and Doctor will take it towards the end. Thank you everyone for joining, and over to you, Dr. Aishwarya.
Thank you, Jennifer, for that wonderful introduction. So good afternoon to everyone here today. First and foremost, I'd like to thank Dr. Aruna Jagdish, Jennifer from FFE, and the whole FFE team for giving me this wonderful opportunity. I think it's an extremely wonderful initiative. Had we had someone to talk about different career paths and different possibilities back when we were students, I think it would have been a game changer and things would have been a lot easier. So thank you all once again. I'll just share my screen. Are you all able to see my screen?
Yes, we can.
Okay. So good afternoon, everyone. I'm Dr. Aishwarya Karthik. I'm currently practicing minimally invasive surgery in benign gynecology, and I work with a team at Manipal Hospital in Bangalore. So my main objective for today is to first introduce you all to the world of robotic surgery and what it entails, to tell you about the various types of surgeries, different paths to form a career, and what all your options are, and maybe a little bit about how exactly I got here. So let us start off about why I think this talk really matters. For starters, like I said, when someone tells you exactly what they're doing on a real-time basis, you automatically start believing how real it is, rather than just reading a textbook and imagining it like it's fiction. But also, surgery is evolving rapidly with technology, and robotics especially is completely transforming patient care. And you guys could actually be a part of this revolution. So how did all of this begin? Surgical techniques have evolved dramatically over centuries. So from open surgeries with large incisions to now minimally invasive methods, the goal has primarily always been better patient outcomes. So when it all began with open surgeries in the past, it was all about larger incisions for easy visualization. But that also meant more blood loss, higher infection rates, and longer recovery. Although there have been advances in antiseptics and anesthesia, which have made it extremely and infinitely better and have improved outcomes, it's still, sorry, just one second. Yeah. It still needs, there's a lot more that has been advanced now. So then came along Dr. Karthik. He is actually the father of modern gynecological laparoscopy. So taking you back to the 1980s, imagine standing in an operating room when the idea of performing surgery through tiny incisions was actually considered almost impossible or maybe even absurd. That's exactly what this person went through when he pioneered laparoscopic surgery. He was the first to start, I mean, he did the world's first laparoscopic appendectomy back then. And his colleagues were actually very skeptical of him, even accused him of malpractice. And an interesting fact about him is that when he introduced them to all of these things that he invented. They actually made him undergo a brain scan, because they thought that only a person with significant brain damage can actually think this far ahead and perform surgery like this. But that didn't stop him. His boldness and his vision transformed surgery forever, proving that we could actually operate with less pain, faster recovery, and smaller scars. Things are definitely changing. So, George Bernard Shaw once said that progress is impossible without change, and those who cannot change their minds cannot change anything. So, the presence of these diverse skills and these changes fostered an innovation in surgical technology over the years. Fast forward to today, laparoscopy has paved the way, but now we're standing at the frontier of something even more extraordinary: robotic surgery. Something that has provided us with enhanced precision, 3D visualization, and greater control. So, enter the Da Vinci system. So, I'm sure you all know who Leonardo da Vinci was. But you may wonder, why is a surgical robot named after him? It's not just because it sounds cool or anything like that, but Leonardo da Vinci was actually what they call a polymath. He was not just a master artist, but he was also a visionary scientist, an inventor, a sculptor, and an engineer. He sketched one of the first known designs of a humanoid robot in the 15th century. And more importantly, he actually explored the intricate details of human anatomy with an unprecedented precision. So, this was actually a homage that was paid to him. And that's why the Intuitive Company, which made the robot, named the robot after him. It's called the Da Vinci. It combines art, science, and technology to perform surgery with unmatched precision, dexterity, and control. So, from the simple laparoscopic tools to today's sophisticated robotic arms, surgery has actually evolved so much, mainly because of people who dared to think differently, challenged the status quo, and also imagined what could be possible rather. And who knows, maybe one of you listening here today will be the next pioneer. As we talk about all the advances in minimally invasive surgery, it's also important to recognize what the limitations of traditional laparoscopy are and why things are constantly evolving. So, maybe for the next few minutes, I may get a little technical here, but that's just mainly to explain why this shift was exactly made and how this came into being. So, while laparoscopy was actually a groundbreaking shift from open surgery, it also comes with several challenges that can affect both the surgeon's performance and patient outcomes. So the instruments themselves, laparoscopic tools are actually referred to as straight sticks. Why? Because they're rigid with no wrist-like flexibility. This rigidity means that instruments actually have a limited range of motion, leading to a loss of dexterity. For example, imagine trying to write your name using the far end of a chopstick. Now imagine doing that same motion while performing a delicate surgery. It's quite limiting, and it's also challenging to say the least. Secondly, there's the issue of visualization. So, laparoscopy relies on a 2D image that's displayed on a screen, which also significantly reduces the depth perception while performing surgery. So, surgeons must actually interpret a 3D space from a 2D image. So, this actually requires intense training, and even then, it's not always foolproof. There's another thing called the fulcrum effect. So, this actually refers to a counterintuitive movement, is what we call it. So basically, the laparoscopic instrument moves in the opposite direction of the surgeon's hand. For example, if the surgeon is moving his hand to the right, the instrument actually moves to the left. So this is actually very mentally exhausting and kind of confusing. So it requires a lot of practice and it demands a constant focus, which makes it a little difficult. Another thing is the eye-hand coordination, which becomes incredibly intensive. So, unlike open surgery, where your hands and eyes are naturally aligned and you're just looking in one place and operating in the same field, a laparoscopy, I don't know how many of you have seen a laparoscopy being done, but a surgeon operates using his hands, which are below him, but he is actually looking at a screen that's quite a distance away. So, the hands and his eyes are actually not aligned. So, again, it tends to confuse things a little bit. So, again, it adds another layer of cognitive strain. This actually makes the learning curve extremely long. It's a very steep learning curve, and mastering this can take years. Not to mention, you need it's absolutely necessary and imperative for an excellent teamwork to be there between the surgeon, the camera holder, or the camera operator, and all his assistants. So any lapse in this coordination can directly impact what the surgical outcome could be. So what do all these factors lead to? One is that there's decreased precision, there's reduced dexterity, and yes, there's something which is very, very important called surgeon fatigue. Fatigue is not just a personal challenge for the surgeon himself or herself, but it's actually a risk factor for the patient also. A tired surgeon is definitely more prone to errors. So this is where robotic surgery changes the game. Robotic systems eliminate all of this rigidity or the straight sticks that we call it because they have wristed instruments. For example, as you can see in the picture here, this instrument in the center shows you the different ranges of motion that a robotic instrument can actually do. So it mimics the natural movements of a human hand, like we would have had in an open surgery. Another thing is that, sorry, I'll show you this video that's just so that you can understand what I mean by it. So the instrument that it's actually moving 360 degrees almost. So this is not possible by a laparoscopic instrument. This is the same motion that we use in an open surgery as well. So your dexterity of your instruments, the precision with which you're operating obviously improves quite a lot. And instead of a flat 2D vision that you can see on this hand picture, the robots actually provide a high definition 3D visualization. So basically you get the depth perception also. So it makes you feel like you're inside a patient's body. The third thing that I explained to you earlier, the fulcrum effect, wherein you have a counterintuitive motion. Again, the robot completely dismisses that. Movements in a robot are actually intuitive, which means that if the surgeon's hand is moving to the right, the instruments also move to the right. And when your surgeon's hand is moving to the left, instruments move to the left, just as nature intended it to be, as we would do in an open surgery again. The system's design also reduces the strain of eye-hand coordination because what you're seeing is what you're operating. So your hands and your eyes and your vision is actually aligned. So again, it reduces surgeon fatigue significantly. So for example, as you can see in the pictures here, on the leftmost picture, this is an example of an open surgery. The surgeon is standing there and he often stands in an awkward and strained position for a long duration of time. He's leaning over the patient and this can lead to back and neck fatigue constantly, especially in longer surgeries. The middle picture shows us a laparoscopic surgery. So laparoscopy definitely having its benefits by being a minimally invasive surgery, so smaller scars and all of that. The ergonomics of it are actually challenging. So the surgeons have to maintain the static position for a long time. Again, it's an uncomfortable posture. His arms are actually elevated because you need to hold your arms up while operating with the instruments. Again, eye-hand coordination from a distance is hard. Our normal line of sight is around 15 to 30 degrees below our eye level. But the surgeon here is looking at a monitor which is very far away, probably not in his line of sight. And he's also looking at a 2D screen from a distance. So all of this causes a lot of shoulder and neck strain. And if you see the right most picture, this is how a robotic surgeon is. He sits comfortably at a console. He sits on a chair basically. His arms are supported. He's operating in his natural and most relaxed position. So all of these hand controls and the 3D vision, the line of sight is maintained. So it's also reducing a lot of physical strain and fatigue, which makes him actually operate a lot better. His surgical skills automatically become a lot better. So this reduces surgical fatigue, which is a real thing. And also because of all of these things that I've just mentioned, the learning curve is shorter for a lot of people. And the need for a perfectly synchronized team is also not as critical because here the surgeon has complete control over all his instruments and also the camera. So in essence, robotic surgery actually doesn't just replicate laparoscopy, but it actually elevates it. It allows us to be more precise, again, less fatigue, and provides better outcomes for the patient. So while laparoscopy was a revolution in its time, robotic surgery is now the future, and the future is already here. So this is actually the latest robot, at least in India. It's called the XI robot, again, by, the Da Vinci, which is made by the Intuitive company. So it has multiple parts. I just briefly explained to you the different parts of a robot that we use on a daily basis, mainly because it's quite exciting to watch. It's something that's different that you don't routinely see. And I also want you guys to be able to really absorb what's happening nowadays to give you an exposure as to what the various things are and what different possibility of career options could possibly be. So there are three different parts of a robot. One is the surgical console, which is on the left. This is where the surgeon sits and he operates inside. I'll also show you small videos that I've taken during our day-to-day practice. Maybe you can have a look at them as well. The middle part is the patient cart, where the arms of the robot actually go into the patient's body, and the right side is the vision cart. I'll explain to you more in detail, but basically, this most advanced XI robot here has advanced instrumentation, better vision, and also something called the Firefly mode, which I'll explain to you in a little while. So this is the console. You can see me sitting here on the right. I'm putting my head into the surgical console. So basically, you can sort of say that it's the surgeon's cockpit. They sit comfortably here and they control the robot from here. So there are sensors which can detect the head of the surgeon. So as soon as the surgeon's head comes out, he stops seeing, and the sensors detect that the head is out. So immediately the instruments freeze inside. So nothing is really happening inside the patient's body without the surgeon actually letting it happen. Let me just put it that way. There's also a microphone here, which is connected to speakers for all the assistants to hear what the surgeon is saying during the surgery. These tiny knobs that I'm holding here on the right are called the master controllers. It's located at the console, and so you can compare them to joysticks, which sort of mimic the surgeon's hand movements. So when the surgeon moves the fingers, the robot automatically replicates these motions with precision. As you can see in the video here, I'm moving the arms of the robot, which are docked into the patient. So I'm just going to play that video again, mainly because I want you to see the range of movements that my hand is able to perform. I'm rotating my wrists quite easily, as you can see here, which is really not possible in a laparoscopy. So this is the foot pedal. Think of these as, say, pedals in a car, but actually used in surgery. So they control camera movement, energy devices, and also allow the surgeon to switch between all of their instruments very seamlessly without taking their hands out. This is the vision cart, as I showed you earlier. This is actually the brain of the system. It houses all the powerful computers, the 3D image processing units, and also supports a camera system that projects a crystal clear view for both the surgeon and his team. So now this is the patient. So these are the arms of the robot, as you can see, and this is called the patient cart. So each arm has to be draped with a sterile drape, just to make the surgical field sterile right before the surgery begins. This is done by the assistant surgeon. And as you can see on the leftmost image here, these are the ports that we put into the patient, and the arms actually go and fix onto the ports that we put. These videos are not playing, but I'll show you this one. This is how we dock the robot. So what we're doing is essentially, after draping each arm, we're connecting it to the ports that are placed into the patient so that the arms fit into the ports. You can see us easily doing it. Let me just fast forward it a little bit. You can see. So this is how we connect it, and that's finally done. Now the surgeon takes over and they operate. So this is how the OT setup looks. So together, all of these components create a system, again, enhancing precision and minimizing the invasiveness. So the best part of this is that the surgeon remains in full control at all times. So a lot of patients come to us and, like, they're a little confused, and they ask us whether the surgeon is going to do the procedure or the robot is going to do the procedure. They're a little apprehensive because robotic surgery is a new thing. People read about it, but they don't really know what it is. And a lot of patients ask us whether a robot is going to operate on them. But that's entirely false. And I just want to clarify that the surgeon is in entire control at all times. They're just being assisted by this robotic technology. So it's an advanced tool guided entirely by human expertise. So this is how our OT setup looks. I'll just show you a video of it so you can understand all the components put together. So you can see here, this is the assistant surgeon. These are the arms of the robot that are moving. This is the system that all of them can see. And this is the surgeon, who's also my boss, who's operating right now. So you can see her moving the instruments, and that's how earlier in the video, you could see the arms moving when she is making those movements by sitting at the console. So that's how the OT setup generally looks. So there are two types of robotic surgery. One is supervised controlled robotic surgery system, which we've just spoken about so far. And the other is telesurgery, which is very interesting, wherein the surgeon is sitting at a remote location and his assistants have docked the robot and are transmitting the live view to him. So recently, there was the news of the first telesurgery that was done in India. A cardiothoracic surgeon in Gurugram actually operated on someone in Jaipur, which is 286 kilometers away, and it went successfully. So this is just proof that the world is constantly evolving at a very, very fast pace. So we saw all the benefits that the surgeon receives whilst using the robot, but what about patients? The most important reason is that the patient is actually very highly benefited from robotic surgery. There are several studies to show us that a patient experiences much less pain, much less blood loss. They have an extremely fast recovery and they get discharged also very fast from the hospital. And obviously, for cosmetic reasons as well. In my own experience, I'd like to share that when we perform a robotic surgery in the morning and say go for postoperative rounds in the evening, our patients are up and about walking around their room with almost no pain. And many of them have even asked us whether at all we've performed a major surgery on them. So they're usually fit enough to be discharged by the same evening or maybe the next morning. So compare this to a conventional surgery, which takes maybe 3 or 4 days for the patient themselves to feel really better. I can safely say that patients find this modality a lot better than conventional surgery. And nowadays, patients are actually seeking us to come and ask for a laparoscopic or a robotic surgery rather than an open surgery. So it's really important that all of us know these advancements because that's what patients are themselves preferring nowadays. So yeah, the cosmetic part of it is really important as well. This is how our incision is in a conventional surgery. It's a large incision. We make it at the bikini line so that it's not visible for cosmetic purposes, but it's still a large one. Compared to robotic surgery, these incisions, we make about 4 of them, but they're all less than a centimeter. They're actually 8 mm to be precise. And we don't, it just heals very naturally and it gives a very good look. For example, here you can see the big scars with the open surgery. Doesn't heal well. The line in the center is not even approximated well enough. But if you can see with laparoscopic surgeries and robotic, you can barely see the scars. This being said, I'm not saying that a robotic surgery can replace all open surgery. There's always a time and place for everything. And a good surgeon knows when not to jump the gun and to also know their limits. For example, we had done a procedure for a large ovarian tumor that we removed. It occupied the whole abdomen, as you can see in the patient. It weighed about 14 kgs. So in such cases, the best for the patient and her well-being is the only thing that has to be taken into account. So the same way for a C-section. Again, we had patients who had earlier been operated robotically for something else and were wondering if their C-sections could also be done robotically. But unfortunately, we had a good laugh, but mentioned that this is not possible yet. You never know what can happen in the future. But similarly, again, keeping optimal patient outcomes in mind, we had a patient who was morbidly obese here. You can see all of the fats, all of her fat on the abdomen. Her BMI was 68.6 kg per meter square. In this situation, doing an open surgery would have probably been a disaster in terms of being able to visualize the operating field inside. The robot in this case made a world of difference because everything was beautifully seen. The surgery went very smoothly, and we could see places that could have possibly not been able to visualize in an open surgery. So, touching upon what are the few surgeries that can actually be done, especially in gynecology. Any surgery, first of all, that can be performed using a laparoscope can also be performed using a robot with obviously greater precision and efficiency, such as a myomectomy, a sacrocolpopexy, tubal microsurgeries like a tuboplasty, which is basically reconstruction of the tube, repairs of vesicovaginal fistulas, hysterectomies, and definitely endometriosis as well. So I'm not getting into too many details, but I also just wanted to show you the different possibilities in a robotic surgery compared to conventional ones and what the differences are basically. For example, a myomectomy being done, I'm just going to rush through this video. Normally, in an open myomectomy, we'd see lots of blood loss. It's a little difficult to visualize everything. But here you can see every single layer so smoothly, so clearly. There's barely any blood loss. And you can stitch and see every layer really well. The integrity of the scar is really, really good. And our pregnancy rates have also been much higher. And the outcome, you can also see, we've done a nice baseball suture here. And it ends up looking as good as an open surgery, possibly even better. Tubal microsurgery, another important thing that I just wanted to touch upon. You can see there's a picture of a grape on the screen. So the robot here, so the precision and the dexterity of the controls of the robot enables a surgeon to actually peel the skin off the grape with such ease. And that's what is actually required in a tubal microsurgery. When we try to do an open surgery for a tubal anastomosis without really using without using magnifying lenses with our large hands, it actually gets really difficult. Can I just show you the small video? You can see the lumen of the tube here. It's almost less than a millimeter. But because of the robotic surgery, you can actually, it's looking quite large here. And you can see there's so much magnification, there's so much precision here. Even this needle that is looking really large in the image, when you actually use it and you take it out and you hold it in your hand, you can actually barely see the thread of it. It's very, very difficult to do this surgery open. So robotic is actually a bit of a boon in this case. Another really important one here, hysterectomies are okay, but in this particular case, there's something called endometriosis. It's one of the surgeon's biggest enemies. Because this disease is actually very, very difficult to operate on, and very experienced surgeons themselves have a very difficult time operating. But the robot, with its very high quality of vision, actually allows us to explain the different nooks and crannies of all the different areas of the abdomen, see every different layer. Here, if you can see, behind the uterus is absolutely stuck to the bowel. And in an open surgery, viewing the area that's behind the uterus requires a lot of effort. It requires a lot of retraction. It's very difficult to visualize that area because you can't really go. But here, the robot is actually being able to go underneath the uterus and show us exactly what's behind. So, again, a boon in such a case. Again, there's something new called indocyanine green. I just wanted to, it may be a bit much for you guys, but I just wanted to touch upon it because things are really evolving at a fast pace. So indocyanine green is actually a dye that's used in cases of suspected or diagnosed cancers, wherein, say, it's injected into the cervix, it's taken up by all the lymphatic supply. And so it goes into the lymph nodes. So when you're trying to do, when we use the robot, there's something called a firefly mode that I had explained earlier. It actually highlights all the lymph nodes because it's taken up by the lymph. And this mode, when you switch on, you can see exactly where the lymph nodes are. Because lymph node dissection is actually very difficult to do. There are a lot of vessels, big, large vessels of our body that are quite close to the nodes. So in order to prevent injuries or prevent any dissection related problems, this actually is very useful so that you can see exactly where the lymph node is. Take it out. I have a very quality video, but again, I just wanted to show you. So this is how the original view is. We change it to the firefly mode. We see exactly where the lymph node is. You can see the greenish part that's being highlighted, and we remove that particular area. So it really helps us in lymph node dissection, which is again not possible in other modes of surgery very easily. The indocyanine green is also very useful in endometriosis, wherein it shows us new lesions of endometriosis. Also, in cases of suspected ureteric injury, injection of the indocyanine green actually highlights the ureters. So one can easily visualize the ureter throughout its course, and that helps in preventing a lot of gynecological related ureteric injuries. So, again, back to the 1980s, nobody ever believed that this would actually become a reality. Now that it has, what else is to come? Obviously, better technology, which we can't possibly even fathom. But now what's coming up of late is a single incision laparoscopic surgery. And again, Da Vinci Intuitive has actually made a single port incision, where this is actually a single port wherein we have the camera and all its instruments as well. Just through a single port, we make a small incision in the umbilicus, put the instrument through it, and the entire surgery is just done through that. Hasn't yet come to India, but people are using it very extensively in Southeast Asia, and hopefully soon it comes to India. Something called a notes that maybe even the final years would possibly know, because I read about this when I was in final year of MBBS as well. It's actually called the natural orifice transluminal endoscopic surgery. So here what happens is it's called a scarless surgery. Here the robot and all its arms are actually placed into a natural orifice, such as the vagina. Again, the laparoscopic instrument, the cameras, all the instruments just go into the same thing. The whole procedure is done. You can visualize very well because there's a camera going inside. You come out with everything. You remove the uterus and there's absolutely no scars at all left behind. So what else is to come? Possibly nanobots. They've already started started targeted drug delivery using nanobots. So maybe they can represent a continuum in the development of these miniaturized robots with a surgical functionality, perhaps in the future. It's definitely a fantastic voyage. And to come to a point where we have technology that provides all of these things to us is incredible. And it's quite exciting to see what's more to come. So, yeah. So coming to exactly how this works and possible pathways for you guys, maybe let me just talk about how I really prefer to give you guys an idea of what the process is. So, a bit about me is that I did my undergraduation in Ramaya Medical College. I then studied for NEET PG like everyone else did. I finished my post-graduation in St. John's in Bangalore in obstetrics and gynecology. I learned a lot during my PG. I did a lot of deliveries, a lot of clinical stuff, some basic cesareans, basic hysterectomies, all open. And also, mainly, what I gathered from my PG was that I was taught a lot about patient care, protocol-based management, and exactly how to prioritize patients. Soon after, I had a government bond, but just before joining the government bonds for 2 years, I had joined a hospital where I was exposed to a lot of laparoscopic and robotic surgery just for 2 months. And for the first time, I actually watched people operate on all of these fancy instruments with such ease and was completely mind blown because patients were just so normal the next day as opposed to what I had seen earlier. So I then moved on to complete the bond with the government of Karnataka at a government medical college. I thought it was one of the greatest experiences, mainly because I got to hone all of my surgical skills. Patient load was very high, so I put to use whatever I had learned in my residency and was able to manage a lot of patients on my own. I finally then learned what responsibility was. I had had an amazing experience for 1 year, but by then I had made up my mind that I actually wanted to pursue minimally invasive surgery. And believe me, it took me the whole of undergrad, the whole of postgrad, the whole of the 1 year of the bond to really understand what I wanted to do. So, just trying to say that there are a lot of career prospects, such as, at least in this field, there's the benign gynecology, there's gynae oncology, urogynecology, reproductive medicine, there's so on and so forth. There's just so much going on. A lot of you may even want to get into research, which I think is a fabulous idea. And with advancing technology like AI, things are just going to make life easier and more interesting. But being in this field is also a lot of hard work, involving preparation of the patient, setting up the OR, performing surgery, and it does not end there. The most important part of being a surgeon is post-operative care and making a patient feel comfortable. That being said, the opportunities are absolutely limitless. And I know many of you are here today with big dreams, some clear and some still forming. Medicine is really vast and it's a huge, beautiful ocean. And standing at the shore can actually feel very overwhelming. And you might wonder many times, how do I make the right choices? But let me tell you something, there's no single right choice at all in medicine. The key isn't to find the perfect path, but it's to find your path. Follow exactly what excites you, like how minimally invasive surgery excited me. Notice the moments where you feel curious, energized, or maybe even challenged in a way that pushes you to grow. That's passion basically trying to catch your attention. And it's not always loud. Sometimes it's a quiet pull either towards a subject that you're interested in or a patient interaction that sort of lingers in your mind for a long time, or possibly even the satisfaction that you feel after solving a tough case or diagnosing something by yourself, especially for the first time. But there's a secret: passion needs discipline to thrive. And you might love something, but without commitment, you'll never see how far it can take you. Show up even on the hard days, and consistency every time. So don't fear making a wrong choice as such. In medicine, nothing that you learn is ever wasted. Every experience obviously adds to your story, your skill set, and your perspectives. You'll keep changing, you'll keep pivoting, adapting, and growing, but that's exactly how it should be. Just always stay curious, stay kind, and stay passionate. I think curiosity makes you a better doctor, kindness makes you a better human. So chase what excites you, work hard, and trust the process. You're not just choosing a career, but you're building a life and make it one that you're actually proud of. So thank you all for a very patient hearing. You can pop in any questions that you may have or anything that comes to your mind, and I'll try my best to answer them. And if you guys ever think that of something later that you want to ask, feel free to reach out to me.
Thank you, Dr. Aishwarya. I think this was a very detailed session on laparoscopy and robotic surgery, and the videos were amazing to see. I'm sure students had a great takeaway from today's session. So we can now open the Q&A session. Request callers to please post your questions in the Q&A box, and the speaker will take it one by one. So our first question for the evening is, please suggest any site where I read articles on recent discovery in medical field.
So I think a good site would probably be something called Up to Date. It gives you a very concise version, but a lot of things that are the most recent articles, it gives you perspective into a lot of things, and it gathers from a lot of different sources as well, and it's definitely authorized. So if you can get an account on Up to Date, I think it's a really good idea.
Thank you, doctor. So the next question is, please tell which books we should start reading from third year.
For your exams or for the future or what?
I think they mean that they're all UG students.
Yeah, I mean, honestly, I think you should just go for each subject, it's different, and there are so many subjects, but I would just say you can possibly speak to your department heads, and they'll be the best ones to guide you. We did the same thing as well when we were in undergrad, and they'll probably give you the best um, because they're in the field in each specific field like ophthalmology, community medicine, ENT. They'll probably give you the best that there is. So I think you should just go by what they say. My knowledge about this is a long time ago, but anything related to gynecology or maybe even studying for entrances, I would gladly be able to help you.
Yeah, so there are questions on any suggestions on people aspiring gynecology who are in undergraduate now, graduation now.
I think the most important thing, like I said a few minutes ago, is passion, because medicine itself is probably not the easiest path to take. But I think the only thing that drove me through the entire undergrad, postgrad, all of those years was passion. Because there are days where it's going to be extremely difficult. And if there's no passion, you're not going to get forward. So you need some kind of commitment in order to be able to deal with it, and that doesn't come without passion. So if you're passionate about it, there's nothing that can stop you. But if you're thinking twice, maybe you can spend a few weeks in different what really actually helped me was my internship as well, because we're posted into different subjects. We have a few weeks of exposure in each, so that actually helps you decide which way to go. You see their lifestyle, you see everything that they do, you see different kinds of cases, you interact with a lot of patients. So that actually gives you a lot of perspective into what you'll actually be interested in. So that really helps as well.
Thank you, doctor. So we have a couple of students asking the same kind of questions on how do you prepare for PG, or how to balance PG preparation while studying UG. So any tips on PG preparation, clearing NEET in the first attempt?
So so one way is, so NEET is full of MCQs, and what we study for undergrad is we actually study it in a little different way because we need to write theoretical answers. So what I would suggest is, if you're trying to clear NEET in the first attempt while also studying for your undergrad exams, every time you take a chapter, you can buy the NEET PG books, like past year's questions basically. And every time you study a chapter and finish studying for the exam, do that same chapter MCQs on the side. So, because MCQs actually test your knowledge about the subject. A lot of what we do while studying for exams is they just they ask you a question very broadly about something, and we can easily write an answer about it. 5, 10 pages we can easily write. But MCQs really test your understanding of the subject. So once you do each chapter, I think you should go through all of the MCQs. It also helps a lot in studying for your theory exams as well, because your understanding improves, your clinical skills become a lot better. Your when you do your practical exams, that helps you a lot. So I think simultaneous each chapter, I think that would be a good idea.
Great. So the next question is, how do we utilize our clinical postings in final year?
That's a good question, because I think clinical postings in the final year are the most important, because those are the main 4 subjects, at least, that we're exposed to a lot more. Because I think we get to see a lot, especially in medicine, pediatrics, OPG, and surgery. It's so we get to see such a vast variety of cases that you shouldn't miss a single clinical postings. So a lot of what at least my batchmates used to do back in the day were to, bunk clinics and go study for exams. And I don't think that's a good idea at all. The kind of cases that you see, the things that because nobody actually comes and teaches you anything except in those clinical classes. In my PG, there was so much work going on. We never had classes that were taken for me face to face, except in my final year in clinics. We had that 1 hour of classes and 2 hours of seeing patients. And so that really, really helped me a lot, because they give you so much valuable information based on their experiences with patients that books will never teach you. They'll never, like, you can read how to examine a patient, but you'll never be able to understand certain things without your professors telling you based on what they've experienced. So things like that have still stuck with me, and I still don't I haven't forgotten a lot of things that I learned back in the day. So,
Thank you. Next question is, which branch will be best for robotic surgery in future?
so robotic surgery is actually gaining traction in a lot of different surgical branches. So gynecology is just one of them. There's general surgery, there's surgical oncology, there's ENT surgery, there's cardiothoracic surgery, there's orthopedics. So literally whatever you choose and you are more interested in, there's always a way to do a minimally invasive surgery in that field. So you can just choose, and things are constantly evolving. Who knows what further is going to happen in the next 5, 10 years?
Yeah. So have you published any research papers so far, doctor? If yes, how do we approach it?
So yeah, so research is something that's um I personally, for me, I had a lot of difficulty in it initially, because one is that it requires a lot of time and dedication. And initially when I started doing this, I didn't really realize how to go about it. So when I joined PG, there was actually this course that I took on research methodology that really helped, and it's a mandatory course that every postgraduate actually has to take in order to teach them what research basically is, how to approach it. And so there is something called basics in biomedical research. That's one of them. Just general courses on research methodology. If you even look up any YouTube videos on how to approach a research paper or what basics in research methodology are, there are a lot of videos that actually tell you how to go about creating. So you need to actually create a research question first. So that's how, seeing various kinds of patients, you create a research question in your head and then work backwards around it, create a sample size, meet a statistician, speak to them, and then slowly you start. Once you do 1 or 2 research papers, you kind of get used to it, and then you can keep going.
So besides curriculum books, what are the other books which you would like most and which we should read?
Uh, mhm. So I personally like to read a lot of research paper articles, basically latest in um, at least in the field that I'm in, or whatever I'm reading. Something like, for example, if I'm reading something in a surgical topic, that same thing has a lot of research articles published, and there are a lot of guidelines that go. So what I used to do is, at least in Gynae, my field, there's something called the RCOG and the ACOG. There are a lot of these bodies, educational bodies, that produce a lot of guidelines on the side. So things that different people do in different countries. So I like to sit and compare different countries' practices for the same thing, and sort of understand why they think a certain way and how they're approaching it and what we are doing different and why. So, we have our Foxy guidelines in India. There are some in the UK and some in the US. So to just combine, like sort of put all side by side and to see um, what benefits patients the most is what I personally like to do.
Yeah. We have an interesting question. What about male gynecologist? I think this is for somebody who aspire to become a male gynecologist. How is the future there for them?
I think you should go for it if you're interested. I've interacted with a lot of male gynecologists, and a lot of the times patients prefer male gynecologists over female ones. I don't know why that is, but especially when I was doing my government bond, I think most of my professors were males, and our female patients used to come just asking for them. So there's no stigma like that anymore, and I don't think there should be. If you're interested in it, go for it. I had co-residents in my PG as well who are male, and they're doing pretty well. So.
Thank you, doctor. So our next question is something about earning. Can you tell something about earning? I am not too sure what they're asking. Maybe in the discipline that you were discussing now, how do they make money? How is the commercial value? Maybe that is what they want to know.
So, one thing is that everything comes with hard work. That's quite important. If you sit in a hospital or if you sit in your clinic for hours together, you have to get paid. So, if again, it depends on where you're working. If you're working in a medical college or if you're working privately, in a medical college, there's always a fixed salary that you get, which would vary depending on the institute. In a private practice, it is you need to sort of establish yourself at least in your area. So that will require long hours of dedicated work, just sitting and waiting for patients to come. There's no question of, um, I'll take just because I'm in private practice to take leave for 2 weeks in a month. That doesn't work like that. Especially if you're in a private practice, you need to work a lot more. And once you establish yourself and you do ethical work and good thing. I mean, if you do good work, good happens. That's how I believe it. So you'll just get that. So, I mean, that's just what it is.
Great. So the next question is the major challenge lies in the affordability of the facility for the people. So how it makes an impression as a better career path?
You mean in terms of the robotic surgery being
Yeah,
affordable?
I think, yeah.
Yeah. So actually, this was when the place that I work at started the robot, maybe in 2011. It was actually a bit of an issue, mainly because it is a superior form of surgery, but that also means that it is a little more expensive. So initially, we didn't have a lot of patients because of that. Only the people who could actually afford it would come. But now the insurance companies are also starting to cover it. So it comes under insurance. So open surgery, laparoscopic, and robotic are all covered by insurance now. So that way, things are actually working out. A lot of medical colleges have also started getting the robot. So I guess that also makes things a little easier.
You, doctor. So our next question is from Shweta. How is the work-life balance for a gynecologist?
I was hoping this question would come, but I think it also depends a lot on how you would like your life to be. So if you would like to fix your hours a certain way, you can, depending on the place where you work at and the type of work that you do. Um, let me just break it down a little bit. So again, if you work in a medical college, your timings could technically be from 8 to 5 or 9 to 5, and then you'll have to do duties every other day or maybe 5, 6 days a month. So that becomes pretty regulated. So your evenings are technically free. But if you work in a private setup, sometimes when you have patients, and especially if you're in the obstetrics field where you're taking care of deliveries, when there's a delivery, you have to go. Unless you are on leave and you've asked someone else to cover for you, but you can't do that to all your patients. You have to be there for your patients when they need you. So that becomes a part of your life after a point. So again, it depends. So if you work in a center where you say that you're not going to do night calls, then it's up to you. But after a point of working, you feel like you just want to be like you've seen this patient for 9 months, you want to be there for the delivery. So you'll automatically go this and you don't think twice about it. You don't feel like it's disturbing your life at all. It just becomes a part of who you are.
Sure. So next question from Sri Sujata.
Sorry,
I'm a
sorry, just 1 second. That being said, obstetrics is not the only thing. You have gynecology also if you want to um, there are so many now super specialties. There's reproductive medicine, which possibly has no night calls, so you get a great work-life balance. There's surgical, I mean, gynecological oncology, again, pretty good work-life balance. There's only minimally invasive gynecology. Again, it depends on how many cases you want to post in a day or something like that. So it's not only obstetrics that you have to do. You can specialize into something and just totally be in that field.
So the next question is from Sujata. She's a second year student and wants to know when she should ideally start preparing for NEET PG.
Mm. Hi, Sujata. But I would first and foremost say don't stress so much about it. I personally started preparing for NEET PG after my final year exams. So, um, during internship, side by side, like I would see cases every day, and I would what I saw, I would come and read and then prepare the MCQs on the side. So I would say that okay, maximum if you're working on the side or if you have work on the side, maybe you can start in final year if you want to clear it on the first attempt. If you don't want to clear it on the first attempt and you want to make use of your full internship, that's also fine. And so you don't necessarily have to write it in internship. You can write it as soon as internship gets over as well. But again, clearing on the first attempt, at least maybe I would say 8, 9 months of studying, especially when you're working or studying on the side for your exams.
So, how to become expert clinically, ma'am? That is like handling cases of diseases.
Practice. So don't go to clinics every day. See as many patients as you can. Talk to your patients every day, but also try and discuss it with someone who's in the field, who's a little senior. For example, if you're scared to go to a very senior professor, you can go to the postgraduates in that department, or you can go to the senior residents in the department. Because one thing about medicine I've learned is that you only learn from your seniors, especially things that books can't teach you. Every senior of mine has always taught me things that I still carry with me to date. So take your cases, speak to your patients, and then maybe if you want to present a case to your seniors or your senior residents or postgraduates, and they'll tell you where you're going wrong. They'll tell you how to better yourselves. And that's the only way that you can. And then go back to that patient. If your findings are wrong, and when your senior tells you that you're wrong, go back to that patient and confirm, and then see what's right, and then compare yourself. I think that's the only way to keep going.
Yeah, so I think we have the last question for the evening. This is regarding books again. So they say we have standard books, but we feel it's hard to grasp all the information, while notes from various institutes are easy to remember. So I am confused that after reading a whole book, I whether I will remember it or not.
So
Okay.
that's what I think studying every day sort of helps a little bit, especially things that you see live. So, example, if you go to your medicine clinics today and see a case of mitral stenosis, to study from standard books gives you so much more knowledge because it explains to you exactly what is happening and why it's happening. Simultaneously, if you read the books of other institutes and these notes that people make, it gives you a gist of what is in the actual book. So I would say if you study every day, you'll have the time to do both side by side. So just take mitral stenosis, study the entire physiology behind pathology behind it, and immediately go to the notes. So it'll give you a gist of what you've just read, and it'll sort of reinforce that memory. And also keep revising, keep studying, and it never ends. Studying medicine never ends. I study even now.
I'm sure, I'm sure. So I think we are pretty much done with the questions. So, Dr. Aruna, would you like to say a few words?
Hi, Jenny. Thank you so much. And Aishwarya, that was an excellent talk.
Sure.
Yeah, so really beautifully brought out, and I think all these students would have really enjoyed it because here they are seeing a youngster like them who's doing so much and so well in practice. So my only point is, now we have understood from Aishwarya's talk that there is so much of advance in medicine. And one thing is, medicine is a science which is continuously evolving. And what one needs to do is to keep themselves updated all the time. You need to read. It's not that like Aishwarya told you, she reads even now. And I'm just like maybe 40 years senior to Aishwarya, and I read every day. So the point is, you have to keep reading and you have to know the latest in your subject because I'll tell you very interestingly what we learned and what we were taught in the 1980s does not hold true today. Lot a lot has changed and a lot will keep changing. So the only way is to constantly read and constantly keep yourself well informed, also remembering that our patients are very well informed today. They come to you with a horde of questions. They come to you with a lot of information. I'm sure Aishwarya, they must be presenting Aishwarya with a lot of information and papers when they suggest a robotic surgery. That is the class of patients we have. So you need to keep yourself abreast and actually not get irritated when patients ask you questions.
Yes,
It's extremely important that we are patient with the information people bring in because knowledge is there, it's available everywhere and everybody has a right to it and they have a right to ask us because ultimately so, my only take because of today's topic is that keep yourself up to date because this is the most beautiful example where technology and medicine have joined hands, and technology is coming in more and more. And Aishwarya put in a very beautiful part saying that the surgeon controls the robot. So ultimately, it's not that if you've learned one skill, we can now relax. The machine will take over. No, it is your work and it is your precision which is going to give the best outcome. So work hard. All of you will have some opportunity in life, whatever it is, and I'm sure each and every one of them will do very well. Thank you, Jenny. And I really enjoyed today's session.
Absolutely. It was a pleasure hearing Aishwarya. I'm sure the medicos found it very interesting because it's their own line. So
Yes,
many of them are in the version of, selecting specializations, choosing various lines. And gynae for male, like you said, it's always been a taboo. I think that you've broken it today.
not anymore.
Yes, yes. It was amazing. And we're truly grateful. FFE is very grateful to, having Aishwarya here, taking your time off on a Sunday and giving this enlightening session for our scholars.
thank
Thank
you
you
so
very much,
much,
Aishwarya.
everyone, for having me here today. I really enjoyed actually talking about all of this. So thank you so much.
Great. And thank you, Dr. Aruna, for making this happen. You've been a
My
strong pillar of
pleasure.
support for our medical scholars. You've always been there to conduct these sessions for our scholars. Truly, truly grateful.
No, I mean it's amazing because these are a bunch of youngsters who want to do well in life. So we should give them every opportunity to see. At least they should know what are the possibilities. How many will land up doing these things? We don't know because we all know how difficult these entrance exams are,
Yeah.
how limited the number of seats are. But yet each one of us has to be totally aware whatever we plan to do subsequently. Okay, thank
Great.
you.
Thank
Thank
you. Thank you,
Yeah.
Dr. Aruna. Thank you, Dr. Aishwarya, once again. And thank you all for participating. Have a good evening.